Mansfield today on a Wednesday, and that means it's time to look at Matters Medical with our resident GP, Dr. Vicky Skitter. Hello, Dr. Vicky.
Hello, Jeremy. How are you?
I'm all right. I've heard about this stuff before, but I don't know anything about it. Now, you suddenly come up and said you want to talk about vampire facelifts.
Yeah.
Oh.
I'm planning stuff.
Oh, you?
I want to see how safe it is. When you see me next time, I'll be 20.
And walking there going, ooh. We're joined by Colette Steenekamp. Colette has been involved in the medical industry and for more than 20 years, mostly as a medical rep and product manager in the skincare and dermatology industry. She now has some of her own products and works as an agent for DermaV Pharmaceuticals. They've developed the platelet-rich plasma treatment for the South African market. Colette, thank you very much for taking time out to join us on Mansfield today. Nice to have you with us. What is... Before Vicky starts with you, tell me now, what is a vampire facelift?
So thank you for having me. I really appreciate this. It's absolutely an honor to speak about something like this. Very exciting stuff. So firstly, it's got nothing to do with vampires. It does involve a little bit of blood, but it's your own blood. You're not going to use anyone else's blood on you. And there's also some needles involved. So if you're a little bit scared of both or either of those, then this might not be for you. But the vampire facelift is a cosmetic procedure that is used, we're using the patient's blood. So it's also called PRP or platelet-rich plasma. So the platelet-rich plasma from the blood is meant to spark natural healing processes and rejuvenate the skin of the face, bringing back a more youthful appearance and coloration while removing wrinkles and adding volume. So by the way, there's a difference between a facial and a facelift. Unlike a vampire facial, which use microneedles or microneedling device, a vampire facelift injects both plasma and a hyaluronic acid filler into the face. The procedure can make the skin look less wrinkled, it can be firmer and more elastic, so giving you that youthful look. So the platelet-rich plasma accelerates growth factors and stem cell rejuvenation using the power of your own body to heal the skin. So collagen production is tuned back on. It will rejuvenate the appearance of the skin, and it's believed that this method is actually much more beneficial and more natural than using traditional dermal fillers.
So how does it work, Colette? I mean, what exactly happens? Do you go in and get blood taken out here and it goes and spun somewhere and then put back into you? Well, how does it actually work?
So the procedure takes about 30 minutes and it happens much the same as a regular filler visit. The procedure begins by drawing blood from the patient's arm. The blood is then put into a machine called a centrifuge, and which then spins the blood tube at a very high velocity to separate the blood cells, the red blood cells, from the platelets. So we actually then compact those platelets, and we use that when re-injecting into the face. So once the plasma is fully extracted, it is then re-injected directly into the face or other areas of the body as well. The injection process moves across the face, placing an injection at about every half an inch or so, and it targets around the area fine lines, wrinkles, and sagging skin. So the entire treatment will take only about half an hour or even less.
Okay. So tell me, Colette, are there any side effects? Is it safe completely?
So a vampire facelift is a non-invasive procedure. It requires only topical anesthesia, and there should be minimal downtime. Side effects may include a little bit of burning, itching, and swelling, especially at the site of injection. The plasma injections in this procedure will fix other issues in the medical world frequently as well. It's used in so many new indications, from orthopedics. It's been used in dentistry. There's a lot of experimental uses by doctors as well. It's often injected into joints to heal other injuries like small tears, or it helps the muscle repair itself naturally. So they have only recently started applying this in the world of cosmetics.
Oh, that's interesting. And what do you tell them? Do they have any specific time period where they have downtime or any recovery time needed if you want to go back to work? Or do a show for Jeremy?
So the procedure typically lasts about 1 to 2 hours, and you should have minimal downtime. If you're comfortable with a little bit of redness, you can obviously go back to work within the next day, even the same day. It takes about 24 hours to really go back to a normal state. So the procedure will likely take place in a medical office, but can also happen in a spa or salons. We're actually targeting salons as well, and we have a unique offering with our product where you can actually do a topical PRP that can be frozen and used in conjunction with other treatments as well. So that's quite exciting.
What are the benefits of this?
So you'll notice immediate soothing, which will result, that will be with the result of fillers. Within 2 to 3 weeks, you should see an improved skin texture and glow, which can last for up to a year. So as the procedure is used in conjunction with microneedling, it tricks the face into thinking it is a massively injured state. So the PRP contains the signals that then are triggered when the body is trying to heal an injury. So that's the normal process that happens in the body. And by creating these micro injuries with the needle from the microneedling device, it also then, and placing the PRP into those injuries, we get a heightened collagen growth and signaling of your growth factors as well as stem cells. So just overall rejuvenation of the skin.
Okay, before Dr. Vicky jumps in here again, I need to ask this on behalf of men. Okay, does it only assist with facelifts, or can it assist in hair loss?
Yes, so there's lots of uses with the PRP, new uses. Jeremy, I must actually tell you that we can even use it in our sexual health as well, in dry eye disease, as I say, in dentistry, in orthopedics. But hair loss is definitely something where we're seeing very exciting results. I've worked extensively with some of the dermatologists as well, and we've had really fantastic results for patients. So definitely not just for the skin, but it does address hair loss as well. It's not just for men who's dealing with thinning hair, menopausal women, certain medications, pregnancy, even COVID at the moment is proving to cause a lot of hair loss issues, and it can then be used as well. So let's break it down like this. The platelets are actually used to address a variety of health concerns, from arthritis, decreased bone density, signs of aging, hence the use as a facial, all can and be treated using PRP treatment. In the case of hair loss, PRP works because it delivers a renewed body or blood supply to the inactive hair follicles, making proper nutrient absorption in deprived follicles possible. This stimulates and supports stronger, healthier hair growth that can then help to fill in portions of the thinning and receding hair. So best results are achieved through regular treatments. A consistent regimen of PRP given once a month for 3 to 4 months, and even every 3 to 6 months thereafter is standard. But of course, the exact schedule may vary depending on the individual patient's needs. So results will follow while following this protocol, or one like this can be expected within the first 2 to 3 months. This is also taking into consideration other supplementation or medication that help hair growth, especially if you are postmenopausal. So despite what the intimidating procedure may suggest, there are actually very few risks associated with PRP hair therapy. You may want to skip your blow dry and take a painkiller to your technician's office for residual soreness afterwards, but besides that, there's nothing scarier than the needles. So if you're a brave soul and looking to solve your hair loss issues or thicken some thinning hair, that normal areas of your hairline, a vampire facial for the scalp can be just the thing to try. So there's been studies done with 30 people, even more. There's lots of studies that we've looked at as well. And results show that PRP performed much better for hair loss than, for instance, Rogaine, which is used often. But the studies also found that your level of platelets can affect how well your own platelets work for your hair loss. So lower levels of blood platelets may mean that PRP is not effective for you.
Very interesting.
Last question,
Last
Vicky.
question quickly. So
Yes.
are there any, I'm talking about the vampire facelift now. Are there any people that shouldn't consider it? Are there any contraindications, like patients on blood thinners or patients that get keloid scarring, something like that?
Yes, absolutely. If you have any skin disorders like keloids, I would definitely suggest not doing any of these type of procedures. Someone that also has conditions like actinic keratosis on the scalp, where you have basically hair or sunspots, we would always recommend a dermatologist first to have a look and see if everything is fine. Obviously, because of the growth factors that's released, you could cause cancerous type cells to grow as well. So if in doubt, I always say go and treat or go and have a look first, get the go-ahead from a doctor. Keloid scarring is also a risk because of obviously patients causing or getting that thickening of the skin, which could be caused by the microneedling and also then injecting with a needle. So again, that would be contraindicated. Other than that, anyone can use it.
Colette, is there, do you guys have a website that we can point people to if they wanted to find out more about this and engage with you at all?
Absolutely. We have got a website, www.dermav.co.za, and have a look under the tab for Diamond PRP, which is our trade name. And there's lots of discussions on all the different indications that you can have a look at. Yes,
Okay.
absolutely.
So that's www.dermav, the letter V, dermav,
That's right.
DRMAV.co.za. Colette Steenekamp, thank you very much for taking time out to join us and look at this phenomenon that people are calling vampire facelifts.
Thanks, Colette.
Thank you. Bye-bye. And Darcy, no, don't look at me like that. You can't bite me.
Bite your neck.
Okay, till next week, we'll say goodbye.
Okay.
Okay,
Bye-bye.
Dr. Vicky Skitter, our resident GP on the medical show right here on Mansfield Today.